From our satellite bureaus, our partners in newsrooms and on college campuses across the state, and from the production studios of Montclair State University, this is NJ Today with Mike Schneider.
People moving out of state. When it comes to the flu, there's nowhere to run, nowhere to hide. It is now widespread throughout most of the country, and New Jersey is no exception. Our David Cruz has a report.
At the West Orange Community House, as in much of New Jersey, flu season has come on early and come on strong. The preschoolers here are both bringing it with them and taking it home. Part of social worker Mary Lou Bruno's job is to keep a running count.
I would say about a third of our population has, in the past 2 weeks since we've come back from Christmas break, we've had quite a few children. I believe yesterday was 37 to 40 children that did not attend, plus we sent home about 5 or 6.
The Centers for Disease Control says 29 states, including New Jersey, have reported high levels of flu activity. That's up from 16 states the week before. Officials warn this flu season could be severe, and it's arrived about 5 weeks ahead of schedule. At the Community House School, staff preach prevention every chance they get.
And then I'm all done.
Unfortunately, the parents will give the children Tylenol at 8 o'clock in the morning and say, oh no, the baby's fine, they're not sick. They come in, they start coughing, sneezing, and whatever all over the place.
Dr. Lawrence Nastro is Chief of Infectious Diseases at Overlook Medical Center in Summit and a master of all things flu.
Actually, influenza was named from the Italians, Influenza di Freddo. Before they knew it was a virus, they thought it was from the cold weather, so they thought influence of the cold.
Nastro recommends that everyone who can should get a flu shot, regardless of age.
Well, obviously, everybody's different, and some people's immune system is more efficient, more effective than others. But you can get it too, in the right circumstance, and you'll be out on flat on your back for a week.
The hospital is doing its part by making sure that staff aren't spreading the flu bug to patients who are already vulnerable, like here at the Neuro Intensive Care Unit, where they're testing a new hand hygiene system.
When you're going into the room, it will pick up your name, and it will be looking for you to wash those hands. So it's giving you a window period within 20 seconds of entering that room prior to touching that patient. It wants to make sure that you're washing your hands, whether you use the hand gel or you use soap and water, depending on what room you're going into.
The flu should not be taken lightly. Those with weakened immune systems, the elderly, and the very young are especially at risk. The CDC reports that as of December 31st, 18 children had died from complications of the illness. The best thing you can do for a person who has the flu is to not become a person who has the flu. So, cover your mouth, wash your hands, and if you're not feeling well, stay home. Doctor's orders. In Summit, I'm David Cruz, NJ Today.